Thank you for joining us today. My name is Jerry Gretzinger, and I'm here on behalf of the New York State Office of Addiction Services and Supports, also known simply as OASAS. This program is a special presentation of our podcast called Addiction: The Next Step, where we focus on important information all New Yorkers should know, or need to know. Our state, our country, is in the midst of the worst overdose crisis in history. But consider this, in 2022, more than 6,300 New Yorkers died from overdose. That's about one death every 90 minutes. And by now you've probably heard what's behind many of those deaths: fentanyl, a powerful synthetic opioid as much as 50 times more potent than heroin that's showing up in fake pills. Over the next half hour, we're going to take a look at the very real toll this is taking on communities in New York State. We'll also see how people who have been living with substance use disorder have found a treatment option that has, in their words, given them their lives back. And finally, we'll let you know how you can get involved in turning this all around by joining the addiction workforce with some pretty incredible scholarship opportunities. But first, the toll these fake pills are taking. People who just don't know what they're dealing with, often young people in their experimental phase, taking just one pill and suffering fatal consequences due to the presence of fentanyl. A scenario that's become a painful reality for families all over the country, including this family from Western New York. In Pittsford, New York, life is generally peaceful, quiet. People go about their daily routines expecting pretty much the same from tomorrow and the next day. Like the Gibbons family, in the middle of their Sunday routine on November 20th, 2022, with no idea what that day would bring them.
It was right at Bill's kickoff, actually. The doorbell rang, and it was Monroe County Sheriff's.
Yeah, it was 1:05. So Kate went, and about a minute later, it was the loudest yell I've ever heard from my life. And so I thought actually it was an intruder or something, because why was she screaming? From that minute on, literally on 1:05 on November 20th, our lives changed forever.
Kate and Dave Gibbons' daughter, Paige, just 19 years old, a college freshman, was dead.
She was at a friend's house. The parents were home. She and her friend were going to take a Percocet, which she thought was a Percocet. They were doing some videos, and unbeknownst to them, it was not a Percocet. It was 100% fentanyl. One person dies, one barely lived, and the third didn't take the pill, and she's here, but now she's witnessed probably one of the worst things a teenager could ever witness in their lives, seeing one friend die and one almost die.
Paige was not a regular drug user. Her parents say from what they've learned, Paige was spending an innocent night with friends home on Thanksgiving break when they decided to experiment with a pill someone was offering up on social media. A fake pill that, like so many others currently in circulation, contained a lethal amount of fentanyl. Paige died after taking one pill, one time.
She trusted maybe her friend, or her friend trusted somebody that they knew, and we just thought of her as maybe a little naive in that respect. Unfortunately, it cost her life.
One mistake was obviously Paige's worst mistake of her whole life.
Yeah.
And, we don't want her being judged for her worst mistake she made.
Paige had plans for the future, plans to help others. Part of the reason her parents are doing whatever they can in her memory to help others avoid a similar fate.
She wanted to be a doctor, and she used to talk to us about opening a clinic in the city where people were underserved. She had her sights set high for doing something really good in the world.
Instead, that one pill has left her loved ones wondering what might have been.
It's caused havoc in our life, and the milestones that I was hoping to have is, our first grandbaby, going to a wedding, her graduating college, her helping other people. None of these things are, going to happen with Paige.
Paige has a younger sister, and her sister and Paige had birthdays a day apart. And so every time her sister gets a year older, Paige does not. And that's the one, I think, it gets me every time. She just keeps getting older and her sister will not. And, I think long after we're gone, her sister will still remember the sister that she didn't get to grow up with.
I kissed her forehead while she's in the casket. And I just had this picture, like my last memory of her. And I have to quickly try to find the fun memories, but just having that horrible memory of me kissing her forehead and just saying goodbye.
I can't believe that we still hear people, having this same exact situation. Like, I want to shout it from the mountaintops and make sure that everybody knows. Expect that it will happen to you. Expect that you will die the first time you try this.
It doesn't discriminate. Socioeconomically, race, religion. Take a pill, you have the potential of dying that night.
Think about this when you decide if you're going to take a pill or do some drug that's been presented to you. Do you want to see your mom's face mourning you?
We're joined now by Dr. Chinazo Cunningham. She's the Commissioner of the Office of Addiction Services and Supports for New York State. And Chinazo, thanks for sitting down with us.
Happy to be here.
Yeah, so we just saw this piece on the Gibbons family, and it made me think of some information that we got recently about substance use disorder among teens. And it said that the number for substance use disorder among that age group has dropped. It's gone down, which is good news, but that the overdose rate has gone up. So I'm going to ask you to kind of interpret what that means.
Yeah, absolutely. So I know that sounds sort of counterintuitive, right? That more adolescents are dying of overdose. But really, what that reflects is the drug supply. So it is good news that there's less addiction among adolescents, but what we know is that the drug supply is deadly. And that's really due to fentanyl for the most part, and then a little bit because of xylazine as well. And so we know that fentanyl can be in anything. It can be in heroin, it can be in cocaine, methamphetamine, and counterfeit pills. And that's really, for adolescents, a big deal. Because now we know with the internet and social media that kids can get what they think are real pills, but who knows where they're made or where they're coming from, and who knows what's in them.
Right.
And so fentanyl is finding its way into these pills, and then that can be deadly.
Yeah, I think it's exactly what happened with Paige Gibbons is the story we just saw. I know one of the things that the agency's been trying to do statewide is increase the availability of things like naloxone. And some people may wonder, okay, I've heard about it. What is it? How does that make a difference?
Right. So naloxone is an opioid antagonist, which means it blocks opioids. So it's not an opioid, but it blocks opioids. And naloxone is not new. It's been around in the medical community for decades. And so this is what, paramedics would use if they would find somebody, unresponsive in the field. It's just now that we're really broadening the reach of naloxone so that anybody in any community can have naloxone. So the way that it works is if somebody is overdosing because of opioids, it blocks the opioids that are inside the system, and then it reverses the overdose. So instead of people stopping breathing, it'll restart their breathing. It's really easy to use. Most of the time people use it through the nose spray, and it doesn't cause any problems or harm. So people don't become addicted to it. And if they don't have opioids in their system, it's not going to do anything. It's not going to hurt them or help.
Right. So there's nothing negative that comes out of administering naloxone.
Exactly.
And the positive is it saves a life.
Absolutely. And anybody can save a life.
Well, Oasis is making naloxone and fentanyl and xylazine test strips available for free on our website. We'll send it to you to your doorstep, no questions asked. oasas.ny.gov for information. You'll also find all kinds of helpful resources on the dangers of fentanyl and other substances, everything from prevention tools to available treatment options. When we come back, how people who've been living with substance use disorder have discovered one of those treatment options that has given them their lives back.
In the event of an overdose, naloxone can keep people alive. Without it, carry naloxone, save a life. Deadly levels of fentanyl are showing up in the illegal drug supply. Request free naloxone and fentanyl strips now. No questions asked. No more lives lost. The New York State Office of Addiction Services and Supports. Here for you, every step of the way.
Hard to believe something this small could kill a person. Not this. This. That's all the fentanyl it takes to trigger a lethal overdose. Fentanyl is showing up in illegal drugs. You can't see, taste, or smell it, but there are ways to detect it. You can now have fentanyl test strips and naloxone sent to you for free. Visit oasas.ny.gov. The New York State Office of Addiction Services and Supports. With you every step of the way.
If you think anyone knows how much fentanyl is in their drugs, you're dead wrong. You can't see it, can't taste or smell it, but there are ways to detect it. Request free fentanyl test strips and naloxone now. oasas.ny.gov.
Alcohol consumption, up. Gambling, up. Overdose deaths, way up. It's time to lower the risk. OASIS, the New York State Office of Addiction Services and Supports, is one of the largest prevention, treatment, and recovery systems in the nation. We're making historic investments in harm reduction strategies to support anyone in need. OASIS, here for you, every step of the way.
For people who've become dependent on opioids or are living with any substance use disorder, there can be some significant barriers to treatment, chief among them stigma and misinformation and lack of understanding in their communities. For example, OASAS works with opioid treatment providers, or OTPs, around the state, and they're delivering some of the most consistently successful treatments available, yet they can often receive criticism and pushback. That's why we produce this next segment, to improve understanding and provide encouragement and support. Every day across the state of New York, people from all walks of life from every region of the Empire State get up and get going. In the Bronx, 59-year-old John Pagan's routine includes brewing up a cup of coffee and walking his dog.
I got me a little Yorkie.
About 200 miles away near Watertown, Justice Mills, 27, has a similarly average routine.
I have a 3-year-old and a 10-year-old.
Today, Justice and John are not unlike many other New Yorkers, thanks in part to something they have in common. Both are clients of opioid treatment providers and receive medication-assisted treatment, part of their routine for recovery.
I was living the crazy life, the insane life that comes with using drugs.
We're a recovering addict.
When Justice Mills was in middle school, she was a good student and a basketball player. An injury on the court and a prescription for opioids set all the wrong wheels in motion.
I was in a relationship with my first boyfriend during this time, and he started to abuse them, and when he started to abuse them, I started to abuse them. I didn't want to come second to drugs, so I thought that if I did drugs with him, that I wouldn't be second to them anymore.
She tried to quit, but withdrawal symptoms were so severe, she felt she had no choice but to keep using. She stopped at nothing to get heroin until she hit her lowest point.
I was prostituting to pay for my habit. I met with a John in a bathroom, and he bashed my head off a sink and took the money and ran. And I was like, I am not doing this. I cannot live this way. This is crazy.
Meanwhile, John Pagan's story started differently. Born in Hell's Kitchen and raised in the South Bronx, John heard anti-drug messages very early. His father was a drug enforcement agent.
He was in the police force all his life. He never was there for us.
John says others were there who took advantage of his father's absence.
I was sexually abused when I was a kid, and that played a big role. on why I started using. I didn't want to deal with life. I didn't want to face the pain.
John was addicted to heroin. He watched family members overdose and die, promised himself he was done with it. But the heroin had taken too strong a hold on him.
When an addict is in pain, that's the only thing we know is to go get high to cover the feelings. We don't like to feel pain. I tried so many times to get clean. Like I said, I was confused. I didn't know what to do.
For John and Justice, different paths had led them to the same place. Quitting on their own did not work. Support groups helped, but not enough. It had nothing to do with willpower or being weak. They realized addiction is a disease, one that must be treated.
This treatment option works. It's better than trying to stop cold turkey.
Dr. Ernst Jean is the medical director for VIP Community Services in the Bronx, where John Pagan is treated and receives his doses of prescribed methadone. The reason a person develops an addiction to opioids is because opioid receptors in the brain become accustomed to unnaturally high levels of opioids. When those levels are not maintained, a person can experience uncontrollable cravings and severe withdrawal symptoms.
Given that heroin and fentanyl go through the body very quickly, one has to keep looking for them all day. And that makes it difficult to do anything else.
Methadone and buprenorphine have been successful in mitigating those cravings and withdrawal symptoms. John's treatment is part of his routine. Once a patient arrives at a clinic, there's a strict screening process to complete before medication is administered. In a matter of minutes, the process is complete. The patient can be on their way or attend group therapy sessions, like John does. In some cases, a patient like Justice can receive take-homes, a multi-day supply of their medication, a practice that increased in popularity during the COVID-19 pandemic and is based strictly on a patient's history with the program, and one that reduces inconvenience for the patient so they can get to work or focus on family responsibilities. For many, treatment is lifelong.
Opioid use disorder is a disease.
Dr. Daniel Paisanello, Medical Director of Credo Community Center in Watertown.
It's no different than someone who needs thyroid medication because their thyroid, which was producing normally at the beginning of their life, is no longer working. These people have a need for opioid that they didn't have when they were born.
People make choices to smoke, drink, use heroin. There is no shame in seeking treatment for heart disease, liver or lung disease, yet stigma surrounding treatment for opioid disorder persists.
In fact, we're helping the problem because once people get stabilized on one of the medications we provide here, they're not out there trying to buy heroin, sharing needles, committing crimes to get money to buy drugs, and all the other bad things that we associate with drug use.
Our patient walking the street is no different than anybody else. Most of our patients live a normal life.
For many, normal includes medication, therapy, daily maintenance and treatment of a chronic condition to be able to go on living life on their terms, not dictated by disease or addiction. Eventually, it all just becomes part of their routine.
We do the laundry, we go shopping, she goes to cooking, and I go in the room, lay down and watch TV, or I'll sit outside and get some fresh air. I'll do what old people do.
I've had jobs, I've gone back to school, I have friends. I have 100% of my family back. They've forgiven me for everything I've done for them or to them. I'm healthy. I can do things that I couldn't do before. I have no problem admitting that I couldn't have done it on my own.
Today I'm able to live and enjoy my life. Recovery is possible.
We're back with Commissioner Cunningham again. And Commissioner, I wanted to ask you about medication treatment, which we just profiled in that piece there. And, you know, I said going into it how stigma and misunderstanding in communities can be a barrier to treatment. So if someone is watching this right now and says, well, how can something that I say or something that I feel be a barrier to someone else's treatment, what would you say to them?
Yeah, I would say absolutely, especially for addiction, because we know that addiction itself has stigma, and then we know that the treatment for addiction can also have stigma, and particularly some of the medications. And so that stigma can lead people to not recognizing their addiction, not seeking help or treatment for their addiction, or leaving treatment or stopping treatment prematurely. We do know that treatment works. There's tons of data, decades of research that show treatment is effective, that medications, really save lives, reduce the risk of overdose by over 50%. But really, stigma plays a huge role into really having a barrier for people really seeking life-saving treatment.
And the success of methadone, the treatment that we were profiling here, is incredible.
Yes, absolutely. Decades of research shows that methadone reduces the risk of overdose. It improves quality of life and a lot of other social outcomes as well. And so we know there are so many benefits to methadone. And really, it's important that we make sure people know that and understand that, because it is one of the most effective treatments that we have.
Yeah, and you talk about sometimes there being a stigma with treatments. The OTPs, the opioid treatment providers, sometimes they deal with that pushback, a little bit of misunderstanding. But again, trying to provide this treatment and us wanting to improve understanding so that it's more embraced and supported what they're doing. Absolutely.
And Jerry, right now is the time that we must expand methadone treatment because we're at the worst overdose crisis ever. The largest number of people have died in the United States and in New York than ever on record. And we know that fentanyl, which is a very powerful opioid, is really fueling that. And so methadone, which is a very potent medication, is really the best option for so many people.
And methadone, I know there are other options similar to it that have a similar outcome.
Yeah, that's right. So buprenorphine, sometimes known as Suboxone is the brand name, is also very effective. So people can get either one of those, and they both have decades of research showing how effective they are. And really, it's about matching the needs to the individual person in front of you. And so people should have options like they do for treatment of diabetes or high blood pressure. The same thing for their addiction is important.
So we want to support not only the people seeking these services and treatments, but support the people who are providing those to them.
Absolutely.
Commissioner, thanks so much again for sitting down with us.
Thank you.
After the break, if you're interested in helping by working in addiction services, we'll tell you how you can get a college degree in the field for free.
Alcohol consumption, up. Gambling, up. Overdose deaths, way up. It's time to lower the risk. OASIS, the New York State Office of Addiction Services and Supports, is here for you every step of the way.
Hard to believe something this small could kill a person. Not this, this. That's all the fentanyl it takes to trigger a lethal overdose. Fentanyl is showing up in illegal drugs. You can't see, taste, or smell it, but there are ways to detect it. You can now have fentanyl test strips and naloxone sent to you for free. Visit oasas.ny.gov, the New York State Office of Addiction Services and Supports, with you every step of the way.
In the event of an overdose, naloxone can keep people alive. Without it, carry naloxone, save a life. Deadly levels of fentanyl are showing up in the illegal drug supply. Request free naloxone and fentanyl strips now. No questions asked. No more lives lost. The New York State Office of Addiction Services and Supports, here for you every step of the way.
If only identifying deadly amounts of fentanyl were this easy. Request free fentanyl test strips and naloxone now. oasas.ny.gov.
Can you tell which one has enough fentanyl in it to trigger a fatal overdose? Neither can we. Fentanyl is showing up in illegal drugs. You can't see it, can't taste or smell it, but there are ways to detect it. You can now have fentanyl test strips and naloxone sent to you for free. Visit oasas.ny.gov, the New York State Office of Addiction Services and Supports, here for you every step of the way.
We've spent much of this program profiling people who've been impacted by addiction, but we would be remiss not to take a moment to call out the addiction workforce, the people who have made it their mission to help provide service and support to those seeking it. But there is a desperate need to increase that workforce, and there's an incredible scholarship program that's available right now that can help you get a degree and join the ranks for free.
The loans adding up were kind of daunting
Melissa Fritsch is not alone. After getting herself started with college courses in addiction services, she was able to enter the workforce. She wasn't done with her studies, though, and wanted to advance her skills and her career. Cost was a barrier.
And so I had been planning to go down to part-time and just kind of pay for things as I could because I didn't want to take out more student loans.
Thankfully, she didn't have to. More than $13 million of opioid settlement funds have been set aside for the Addiction Professional Scholarship Program offered by the New York State Office of Addiction Services and Supports, or OASIS, in partnership with the State University of New York.
You know, there's not a single meeting that I go to where I don't hear about workforce. And
OASIS Commissioner Dr. Chinazo Cunningham says the scholarship program comes from recommendations from the Opioid Settlement Advisory Board. These funds will not only help current members of that workforce advance and prolong their careers in addiction services, but also encourage new students to join that workforce.
So this is really important right now, but is also important as the field moves forward.
Over the summer, I had close to 700 students contact me because they had such an interest.
Thea McMillan is a professor and department chair of Health and Human Services and oversees the Addiction Studies program at Empire State University, one of 3 SUNY campuses offering addiction courses and degrees participating in the scholarship program. She says the interest has been overwhelming because the scholarships cover all course fees for eligible recipients. They could be getting their schooling for free.
Yeah, exactly.
There is also credit for prior learning, whether that learning happened in a classroom or out in the workforce.
So it really reduces down how much time they have to finish, right? And that's what so many of them want. If we can help them do it with this, I see it as such a huge, huge gain.
A huge gain for students like Melissa and Gary Lunderman.
The first goal was to take 1 class per semester, and when we were presented the email to anybody through OASIS, there was, now I can speed this up, maybe I can take 2 to 3 classes per semester.
All courses are online, so anyone anywhere in New York State can apply.
I absolutely love the work that I do now. It's just so much more fulfilling.
We hope the last 30 minutes has helped to increase understanding of where we're at with the overdose crisis, how to prevent tragedies and reduce harms, and how important it is to support those seeking services or supports. We've given you our website a few different times, but if you're looking for services, you could also call the New York State Hope Line. That's available 24/7. And we're on social media. Check us out on Facebook, X, YouTube, Instagram, LinkedIn, and of course, our weekly podcast, Addiction: The Next Step. OASIS is here for you every step of the way.